Ever woke up in the middle of the night with a sharp pain in your lower right abdomen? Could it be your body's alarm sign? Today, we pull back the curtain on a common yet often misunderstood medical mystery: appendicitis. Imagine a small finger-like pouch in your digestive system, tucked away in the lower right of your abdomen. Most of the time, it's harmless, but sometimes it can become your body's ticking time bomb. This is your appendix, and when it gets inflamed, it results in a condition we know as appendicitis. Recognizing the symptoms early is crucial. Why? Because appendicitis can quickly escalate from a mere annoyance to a life-threatening emergency. The pain you dismiss might be your body's desperate plea for help. So, let's delve into this mystery together. Let's understand the signs, the symptoms, and what to do when this silent alarm goes off. Because understanding what's happening inside your body could be the difference between a quick recovery and a medical emergency. So, what exactly is this pain in your lower right abdomen? Well, it could be the hidden culprit we're here to discuss today: appendicitis. Now, don't be alarmed by the term. It's just a fancy way of saying that your appendix is inflamed. The appendix, you see, is a small pouch-like structure that dangles off your large intestine. While it may seem insignificant, it can cause quite a ruckus when it's upset. You might be wondering, why do we even have an appendix if it can cause such discomfort? Well, some theories suggest it might play a role in your immune system. However, its definitive function remains a mystery. Now let's discuss the cause of appendicitis. It usually occurs when the appendix becomes blocked, often by stool, a foreign body, or in rare cases, a tumor. This blockage leads to an increase in pressure, which disrupts blood flow and causes inflammation and swelling. If left untreated, the appendix can burst or rupture, releasing harmful bacteria into the abdomen. Quite a nasty situation, isn't it? Let's delve a bit into the pathophysiology of appendicitis. When the appendix gets blocked, bacteria inside the appendix multiply rapidly. As a result, the appendix becomes filled with pus and swells, leading to pain. If not addressed promptly, the wall of the appendix can become necrotic or dead due to lack of blood supply, and ultimately, it can rupture. So appendicitis isn't just a simple stomachache that you can ignore. It's a serious condition that requires immediate medical attention. Remember, the longer the inflamed appendix stays in your body, the greater the risk of it bursting and causing further complications. Now that we know what appendicitis is, let's delve deeper into its signs and symptoms. Stay tuned to understand how to identify this hidden culprit lurking in the corners of your abdomen. It's always better to be knowledgeable and prepared, isn't it? Scene script. Recognizing the enemy is half the battle won. So what are the signs of this hidden enemy? Appendicitis, a condition that can sneak up on us, often starts with subtle symptoms. The initial sign is typically a dull or sharp pain that begins around the navel area or the middle of the abdomen. This pain might seem insignificant at first, similar to a minor stomach upset. However, as the inflammation in the appendix intensifies, this discomfort often becomes more concentrated and severe and migrates to the lower right part of the abdomen. In addition to this hallmark abdominal pain, there are other telltale signs of appendicitis to watch out for. One might experience a loss of appetite, nausea, or vomiting soon after the abdominal pain begins. An escalated body temperature, usually between 99 and 102 degrees Fahrenheit, can also be a signal. Further, appendicitis can cause swelling in the abdomen, an inability to pass gas, and severe cramps. Some people might also have diarrhea or constipation with gas, and a general feeling of being unwell. These symptoms can appear rapidly, within a few hours, or develop slowly over the course of several days. It's worth noting that not everyone with appendicitis exhibits all these symptoms, and the intensity and sequence can differ from person to person. For instance, some might not experience the classic migration of pain to the lower right abdomen, particularly young children and pregnant women. It's also important to remember that these symptoms can mimic other health conditions like gastrointestinal disorders or urinary tract infections, which makes a professional medical evaluation crucial. So how do we battle this hidden enemy? By being alert to these signs and taking action promptly. If you or someone around you experiences unexplained persistent abdominal pain, along with any of these symptoms, it's time to seek medical help immediately. With these signs in mind, it's crucial to know when it's time to seek medical help. Now that you know what to look out for, what do you do when you suspect appendicitis? Well, the first step is always to seek immediate medical attention. Your doctor will likely start by conducting a thorough physical examination. They'll be looking for signs like tenderness in the lower right quadrant of your abdomen, which is where the appendix is located. However, a physical examination alone isn't enough to confirm a diagnosis of appendicitis. That's where imaging studies come into play. These might include an ultrasound, an abdominal X-ray, a CT scan, or an MRI. These tests help the doctor visualize the appendix and assess whether it's inflamed or not. Another diagnostic tool that doctors use is a blood test. When your body is fighting an infection, like appendicitis, your white blood cell count will be elevated, so a blood test can provide further evidence to support a diagnosis of appendicitis. But what happens once you've been diagnosed? Well, the most common treatment for appendicitis is surgery to remove the appendix, a procedure known as an appendectomy. The appendix is a small, finger-shaped pouch that branches off from the large intestine, and humans can live perfectly healthy lives without it. There are two types of appendectomy: open and laparoscopic. In an open appendectomy, the surgeon makes a larger incision in the lower right area of the abdomen. In a laparoscopic appendectomy, the surgeon makes several smaller incisions and uses special surgical tools fed through these incisions to remove the appendix. The choice between an open or laparoscopic appendectomy will depend on various factors, like the severity of your appendicitis and your overall health. In some cases, if the appendix hasn't ruptured, antibiotics may be used as a first line of treatment. However, most often surgery is recommended to prevent complications like perforation or infection. Remember, appendicitis is a medical emergency. Early detection and prompt treatment can make all the difference when dealing with appendicitis. So if you or someone you know is experiencing symptoms suggestive of appendicitis, don't wait. Seek immediate medical help. We've covered a lot of ground today, but what are the crucial points to remember? Appendicitis is the inflammation of the appendix, a small organ attached to the large intestine. It presents with signs like abdominal pain, nausea, and fever. The key is to not ignore these symptoms, as they could indicate a medical emergency. Early diagnosis and treatment, usually surgical removal of the appendix, are vital to prevent serious complications. Remember, your health is in your hands. Stay alert, stay informed, and stay healthy.